Thanks, Rod. Thanks for the introduction, and thanks for having me involved in this webinar series. I'll just share my slides and we can get going. So today I'll be presenting as part of the Aspatile webinar series on hamstring strain injuries. My name is Dr. Ryan Timmins. I'm from the Australian Catholic University in Australia, and thank you for having me along, Rod, and hopefully this is informative for you all. So my talk today will focus on a couple of topics. The first one looking at the magnitude and the laterality of muscle recruitment during hamstring exercises, and kind of focusing on this concept of exercise intensity to drive some favorable hamstring adaptations. So to start with, I'll introduce this concept of laterality. So when I speak about our concept of laterality, we're looking at the hamstrings here, and we're comparing exercises that might recruit, say, more so the lateral hamstrings or the medial hamstrings. So there's balance between, say, one exercise obviously recruiting a range of the hamstrings, but is one more medial or laterally biased in its recruitment? So this concept of laterality. So what does the literature say about exercises and their ability to recruit between the medial and lateral hamstring? So here we've got a bit of work from a review from Matthew Bourne over here in Australia as well, as comparing what the evidence says with functional magnetic resonance imaging and comparing the activation profile of certain exercises. So on the y-axis, we've got the exercise, and on the x-axis, we've got our intensity or ratio of medial or lateral hamstrings. So if it's less than 1, we've got a relatively higher medial hamstring activation. That's greater than 1, we've got a greater amount of lateral hamstring activation. And what you can see is there's a pretty decent split between things being more, having a greater trend towards more lateral hamstring activation when they're actually hip dominant exercises. So anything really above here, we can see are mainly hip based, and we're probably getting over a 0.6 recruitment, showing that probably more biceps femoris usage with our hip dominant exercises. Once we look at exercises that mainly focus on the knee, we go to a greater extent of medial hamstring recruitment than lateral. And so obviously these exercises such as the Nordic and so on and so forth are very knee based. And as a result, we have a greater recruitment of our medial hamstrings. But this is just one concept that we need to consider when selecting an exercise. This is just the balance between our lateral and our medial hamstrings. It's a big focus within the clinical space, is do we just pick an exercise because it's more medially biased or more laterally biased? But one concept that gets lost when making this decision is the concept of magnitude, and the magnitude related to intensity. So whilst you might have an exercise that more preferences the lateral hamstrings, it may be poor in its magnitude to actually do so. And what that actually looks like, I'll cover through now. When we speak of magnitude, we speak of basically how much of the muscles are recruited. Okay, we still have that balance between left and between medial and lateral, but now we're looking at how high we can actually recruit those two groups of muscles. So again, some great work from Matty Bourne in Queensland, Australia, and basically some of the work he did is had a bunch of exercises we can see here, some hip-based, some knee-based, and compared the extent or how much these muscles are active during certain exercises. What we've got here is that balance between our medial and our lateral hamstrings from these exercises. So on the y-axis, we've got our lateral hamstring EMG, so how much the lateral hammies were activated during these exercises. So the higher up we go, the more lateral hamstring we use. And on the x-axis, we've got our medial hamstring activation. So the further along we go, the more medial hamstring we use. So we pick out two comparison exercises, one being the knee-based Nordic, and then one being hip-based hip extension at a 45-degree. And we can see, as what we got from the last slide, our hip extension exercise on the left-hand side of this diagonal line is more biceps femoris active basically what this diagonal line is at that balance of 1. Again, whether it's a medial or a lateral dominant exercise. So hip extension is more lateral, than medial hamstring dominant, whereas our Nordic, being on the right-hand side of this line, is more medial hamstring than lateral hamstring. So that takes into concept our laterality. But one thing that's missed a lot is this concept of intensity or magnitude. So with our Nordics, we can see here, whilst they're a medial dominant exercise, they're still the greatest recruiter of our lateral hamstrings as well. Our hip extension, our greatest lateral hamstring recruiter, actually has a lower amount of lateral hamstring recruitment relative to the Nordic. So magnitude is really important. This intensity is really important. Comparably, the medials, we can see there's that balance between the recruitment. So our Nordics is probably the best exercise to recruit both of the hamstring muscles to their maximal capacity, whilst being more medial biased in its recruitment. Okay, so it might recruit the medials more than the laterals, but overall, compared to other exercises, it's much better at getting the laterals going than what the others are. So then there's this balance between intensity and volume. You can't train intense forever, but you can't always just do nothing at low intensities. So there's always a balance between prescribing high intensity exercise, especially in when we're looking at using this magnitude-driven approach, and balancing that with training volumes and how many repetitions we do in a gym at certain intensities. So this leads me into my next concept, which is why programming just 3 sets of 10 doesn't work anymore. And we consider how much our intensity and our programming of these exercises comes into play. We need to consider this much more. So one example we've got here is why 3 by 10, or typically, well, in this actual study, it was 12 by 10 by 8, just really isn't done anymore. So the best evidence we've got for injury prevention in elite sport is using the Nordic hamstring exercise from some of the work done by Christian Thorberg and co. in 2011 in the Peterson study. And there's some follow-up work undertaken recently looking at the actual adherence to these exercise programs in Champions League football teams. So the prescription of this evidence-based training is that in season, after doing this pre-season kind of dose, that teams are required to do at least 30 repetitions a week. So if this evidence-based approach, which is the best approach we have at reducing the risk of hamstring strain injury, suggests that Champions League teams should be doing 30 repetitions of a Nordic per week. If not, they're not compliant. Probably needs to be considered in context. So let's have some context. Manchester City in November 2018. Just a random year and month picked out, but this is their schedule for that period of time. So a Champions League team trying to undertake 30 repetitions of the Nordic per week, ideally in one session. So let's have a look at where we could possibly fit this in. Okay, maybe there. That's probably about it. We could possibly put one in here before the Man United game, but it's highly unlikely you're going to get more than one session in a week, especially when you've got so many games close together. So this then creates the consideration, because remember, our Nordic was very high in its magnitude of recruitment of the muscles. So we need to find this balance between a highly intense exercise and the volume with which we can do. So possibly not 30 repetitions, but maybe could we do lower volumes and maybe still get some favorable adaptations that may possibly help us reduce the risk of injury. So some evidence we've got from some training we've done here in Australia from Joel Preslin's research in 2018. We compared a high volume Nordic training exercise intervention to a low volume intervention and looked at strength and structural adaptations as a result. So if we do low volume or high volume training, so the high volume guys did much more than what we actually saw in the Norwegian group, or sorry, the Scandinavian group, and we actually saw a 34% improvement in strength and basically no difference between the groups. So doing high volume or low volume, you can still get stronger. Architecturally, looking more so at muscle fascicle length, we can see that both groups improved muscle fascicle length longer over the 6-week intervention. So from here, you can see there's no added benefit to doing more exercise than we have to. So that balance between intensity and volume is key. But one key take home for me, and like I said, there's that main point here, is the intensity of the exercise. So the Nordic is quite hard and quite taxing. But in that study that I just presented, the big take home is, whilst you might be able to, yes, do lower volumes, the intensity of those lower volumes are really, really important. Okay, if you still want to drive favorable adaptations, you need to still have people training at a high intensity. And how is that maintained once you do, maybe 10 weeks of training of 2 sets of 4, is adding weight. So here's one example of a participant we had at some point in the training study. He utilized a Nordic with body weight, an additional 35 kilograms held to his chest. And you can see here, this is probably set 1. You may have gone back a little bit as you went. That's what we're looking at for that intensity of effort. So whilst we may have a lower volume, we do need to still consider that intensity as part of our prescription and also part of our calculation of volume. So really need to consider intensity. It just gets lost in the wash a lot. And to continue on that, we actually have some evidence to show this. So say if we did 6 weeks of low volume training, so carrying on that same intervention that we did in the Breslin study, we have low volume training, 2 sets of 4 of the Nordic, again done at a very high intensity. We compared the people that just use the body weight approach, so they get stronger, they get really good at the Nordic, and then they stop really getting overloaded. And then we had guys that we just kept loading up with lots of weight to make sure every effort was really, really hard and really full. And we compared what happened. We also did use an exercise called the razor, but I won't talk about that today. So basically what we saw from an architectural point of view, the guys that used the body weight only had a 5% improvement in architecture, and the guys that used the extra weight had about a 15% improvement in their architecture. So this kind of gives us the idea that maybe the improvements that we get over 6 weeks from a low volume intervention really need to be matched with a high intensity if we're going that low volume. That intensity is really key and can't be forgotten. From a strength perspective, both groups improved around about 19% in their levels of eccentric strength. Again, like I mentioned, the average weight held at the end of training was around about 20 to 30 kilograms, and that's a big key component we need to consider in regards to our intensity of prescription. Last thing to kind of finish off is about running intensity. Okay, we're talking a lot about gym-based prescription, but again, intensity really matters when we're considering our intensity of prescription for running or sprinting. Here we've got some work from Shumanov and the guys in 2007 looking at the amounts of muscle tendon length change, the amount of muscular force, and the muscle tendinous work. Also, this is considered the amount of eccentric or negative work done by the hamstrings during certain speeds of maximum sprinting. So obviously the higher up we've got a higher change relative to their maximum. So what we're seeing here is across the speed spectrum, if we're at 80%, 85, 90, 95, 100%, our muscle tendon unit length doesn't really change from 80% onwards. The length of our muscle doesn't really modify with increases in speed. The amount of force produced has this linear relationship as we improve intensity. So the faster we run, the greater amount of force that we're actually having go through that MTU. And that's pretty linear. So as you go from 80 to 85, it's a pretty decent step to 90, 95. The one that's very interesting is it says a big peak here in the amount of negative work, so the amount of eccentric work the hamstrings do when we go from 95 to 100%. So you can see that decent jump in the amount of intensity, the amount of work, the negative work the hamstrings do. So we really need to consider, and this highlights really well, how important max velocity is. So if you're prescribing high intensity sprinting and you're going 80%, 85%, you're possibly missing out on almost 30 or 40% of negative work when you're thinking, oh, 80% is close enough to 100. Well, you're actually probably missing out a fair chunk of intensity here that might be useful for your participants or for your clinicians. So for me, just finishing off, some key important take-home messages. Laterality is important if you're trying to recruit the hamstrings, but also consider magnitude. Magnitude is driven by intensity. We really need to consider that, just that balance between the two medials or laterals, but how hard they work. 3x10 doesn't cut mustards anymore. We need to actually go quite hard, and doing things quite hard, you can't do that 3 sets of 10, especially in practice when you have 3 games in a week. When we program things, we do need to remember that intensity is part of our programming calculation for volume, so sets by reps by intensity. If you just go 3x10 and you don't change that, you're going to forget that intensity is a really key factor of our programming. Running intensity is key. Again, the balance between 80% and 95%, even 100% of max sprinting has a big difference to the implication of the hamstring work that we do. So for me to say thank you for today, for having me involved, Rod, and the guys at Aspetar. Again, everything I presented today is not just all my own work, but a bunch of work that we do across the group. And we wouldn't be where we are today without Dr. Anthony Shield, Dr. Morgan Williams, and Dr. David Opar. So thanks to everybody on this slide, and thanks to everybody in Doha and around the world for listening.